But well, thank you, Karen. Um, Karen is off screen right now, but she's on under the COFA little square there. Um, but anyways, welcome to our public hearing today. We're holding this virtually and recording it so we can have future viewings, and we will put it on the county's YouTube page. After I'm done talking and I start the presentation, if we're just asking that everybody can turn off their video camera and mute themselves so we can just manage the presentation a little bit easier. We will be addressing questions at the end. We've received some questions already ahead of time. We will read those questions out loud and the questions that folks put in the chat. You can also chat in your questions as we go along. We'll read those at the end of the presentation and respond with to our best ability to those questions. And we will also give time and open it up for brief feedback and questions at the end. I was saying that I was going to thank the advisory board members. However, I don't see any of our advisory board members on the screen yet. So those are some of the folks I imagine will be trickling in. I also want to thank Karen Bullis. Again, she's under the COFA little square there. She is our deputy director, Karen Bullis, who is in control and recording the session and recording the chat that is coming in as we speak. And also Andrea Davis, who is our aging service specialist. And she's going to start us off with programs and services of our office. But just a little background, we're required to submit a plan to the New York State Office for the Aging every year with feedback from the communities. So this is something we do through a survey, through regular collection of feedback that we get throughout the year, and also this opportunity at our public hearing. The state has been delayed since COVID, and we're a little behind schedule. So this hearing and the information that we needed to do this hearing was just received in September from the State Office for the Aging. So this plan that we're going to be talking about today addresses the needs and plans for 2025. As you know, we're quite far into 2025, so we're going to be talking about what we've done and how we will be finishing the rest of our year. So I will now begin the presentation, and I'm going to hand it over to Andrea. Let me see if I can get this up and going here. How does that look to everybody? Can you see the presentation? Oh, hello, Deb.
Hi.
It's at the
How
end.
is
It's at the end.
is
Oh, nope, there it is.
okay, perfect. I'll just quick take a step back. I don't think we have any other advisory members on, do we, Karen? Except for Deb?
No, we don't.
Okay, Deb, I'm just going to introduce you to everybody. I know everybody's trickling in and we're going to get our presentation started, but Deb Rowe is our vice chair of our advisory board committee. So thank you for coming and being part of this whole process with us.
Can they see me?
Yes, right now, we are asking if everybody can shut your cameras off once Andrea starts and mute yourselves, just so we can manage the presentation and let people in if they're coming. And thank you, and I will hand it over to Andrea at this point.
All right. Thank you, Lisa. Thank you all for joining us today for our annual public hearing. Our mission here at the Tompkins County Office for the Aging is to assist older adults and persons with long-term care needs to live independently in their homes and communities with quality of life and dignity. I will give you a brief overview of how our office accomplishes this in our community. On this slide you see here are our resource guides that we update in the beginning of the year. These guides are available for pickup in our office. They're available on our website, and we take them with us to the various tabling events that we attend throughout the year. And I'll just give you a brief overview of each booklet here. Our Falls Prevention Resource Guide has information on local strength and balance programs, ways to make your home safer, and places to get assistive equipment and technology. Our Housing for Older Adults booklet lists the independent senior housing complexes that are at or below market rate, along with adult care facilities. Our Long-Term Support Services Guide goes into detail about several different types of supportive services that are available in our community. Some of those services include in-home assistance, meal and shopping services, caregiver support services, transportation, home repairs and modifications, and financial assistance avenues. And lastly, our Resources for Caregivers Guide. There's a lot of similar information in this guide that you will find in our Long-Term Support Services Guide. Our Resources for Caregivers Guide dives into several different caregiver-specific resources like information, referral, and educational programs for family caregivers, counseling opportunities, caregiver support groups, kinship caregiving resources, long-distance caregiving, respite and adult day programs, and services for employed caregivers. All right. I'm giving you a brief overview of our resource guides. There's, like I said, a lot of great information. I only touched on a few things that are available to our community members. So I will now talk about our directly provided services in our office. Our staff are always happy to assist if anyone has any further questions or would like to access these services. We receive funding through New York Connects, and through New York Connects, we do a lot of person-centered counseling, referrals, and we share information on a broad range of services. Our office also has personal emergency response systems, which we call PERS units for short. Thank you. Our PERS units are our medical alert systems, which link the individual to emergency assistance in case of a fall or a medical emergency. We also provide health insurance counseling. I am one of the 3 certified health insurance counselors at the office. We counsel in Medicare, some Medicaid, and private health insurance. Lisa? Thank you. We do a lot of public information and outreach for our programs and services. Any updates that happen throughout the year, those can all be found on our Facebook page, our website, the Senior Circle newsletter, and our email list. And like I mentioned, we table at various events throughout the year, and we share all the information that I will talk about here and more at these tabling events. All right. Next is our Caregivers Resource Center and Alzheimer's Support Unit. Through this resource center, we offer respite. We have a lending library. We offer support groups, workshops, and classes, and information and assistance pertaining to caregiving. Next. All right, our Project Care program, it's our friendly visiting program that links volunteers in our community with isolated older adults. These volunteers provide companionship, which can range from going on a walk, playing a board game, or reading a book together. Next is the Home Energy Assistance Program. Eligible applicants for this program receive a one-time benefit that supplements their heating costs for the winter. Next. And next, we also provide home safety assessments and aging in place evaluations. Our staff can make a home visit at no cost to the client and go room by room to identify various fall risks that may be present and to give information and resources for those who are aging in place. Next, we have our Senior Farmers Market Nutrition Program, which gives eligible individuals a $25 booklet of coupons that can be used at participating farmers markets on fresh, local, unprocessed fruits and vegetables. Next. We also give out Gadabout transportation tickets for clients who are 60 and older, and that can be used on different types of rides with Gadabout as long as you schedule ahead, and we can give them a certain amount every 12-month period. All right. We have personal care aids that are available through ISEP, which I will expand on in a moment, and our unmet needs programs that provide wraparound services to help people stay in their homes safely. All right, next is our long-term care ombudsman program, which serves residents in adult care facilities in Tompkins, Chemung, and Schuyler County. Ombudsmen advocate for residents in these facilities and work to protect their rights, honor their dignity, and ensure respect. There are also a few social engagement innovations that we have through our office. Those include Joy for All companion pets and games, LEQ, which is a digital companion, and a virtual senior center through Lifelong. Next. We maintain a yard work and snow shoveling list. On this list are independent individuals that are willing to assist older adults on either a paid or a volunteer basis. And lastly, through our long-term care services unit, we provide case management and have our expanded in-home services for the elderly program, which we call ISEP for short. This is a cost-sharing program for a personal care aide, and there's also some caregiver respite available. Okay. So there are several agencies that we have contracts with to provide the services that we do not provide directly in our office, and I'll go through that now. First is FoodNet Meals on Wheels. This agency provides congregate and home delivered meals and nutrition counseling and education. Another subcontractor is Lifelong. This agency publishes the Senior Circle newsletter. They have the Mosaic program, Aging Mastery program, tax program. They also do health insurance counseling, Bingo Size, and they have a virtual senior center. And in case you're wondering what Bingo Size is, this is a health promotion evidence-based program that combines socialization and exercise. Another agency that we work with or contract with, INHS. This agency completes health and safety related home repairs for income eligible older adults. We contract with the Finger Lakes Independence Center. They maintain the registry program, which links individuals who need in-home assistance with independent persons for hire. We contract with the Legal Assistance of Western New York, Law New York. They provide legal assistance in civil matters. And we also have a contract with the Human Services Coalition, and they coordinate the Long-Term Care Committee. And lastly, we have contracts with Caregivers, Home Instead, and the Finger Lakes Independence Center, a consumer-directed program to provide personal care and chores and housekeeping assistance. That was a lot. I'll turn it back over to you. You're muted.
Yep, there I am. Thank you, Andrea, for going through all that. That's great. I will now talk about our plan abstract, our programs, and some of the priorities that we have been working on and that we'll continue to work on through 2025 and probably beyond. Just to kind of give you a little broad overview, we administer 28 different programs. We have 26 different contracts with 14 subcontractors, and Andrea had mentioned a few. There's still some small contracts that we do that we haven't added to that. We have 22 different funding streams, 9 federal, 9 state, 3 local, interdepartmental, and 1 private grant. And we do all these programs and services that Andrea mentioned and the priorities that I will be mentioning with about 19 staff people in our department. There's 15 full-time and 4 part-time staff. So our New York Connects program, really this program provides residents of the county of all ages with objective and comprehensive information about long-term care services and supports. We will continue to prioritize that. It's part of our outreach plan, our outreach and information and assistance program. Age-friendly, Ithaca Tompkins. I'll try not to read all these, but there's a lot of information and I just want to try to touch on the main points. But we've been doing our age-friendly work since 2015. It's evolved over the years. In 2025, we are continuing to work on our goals and tasks that are associated with all the age-friendly work that we do. But we've been working with Dr. Janet Lobach, and her students on age-friendly businesses. And age-friendly business basically is our organizations or businesses that provide specific amenities, for example, bathrooms, well-trained customer service to really better the experience of customers of all ages. And we are doing a kickoff. There's a fly in here, and I don't know why. It's going to be in my face, apparently. Sorry about that. But yes, the age-friendly business program we've been working on it for about 4 years. We're ready for a kickoff that's going to be happening in the next couple weeks. So you may hear some more information about that. But those businesses will be designated as age-friendly as they had to go through a process of certification, and they will be receiving that certificate and stickers and things to identify to consumers that they are an age-friendly business. Okay, to continue, we'll continue to work with our Doyle Medical Monitoring, which is our contractor to provide the personal emergency response system to residents. We've had some new technology. We'll be working with that, and we hope to increase the program by 10% in 2025. Our regional long-term care ombudsman program, which Andrea mentioned a little bit, we'll continue to have this program in our office. We have 3 full-time staff who work on the ombudsman program. Their efforts will be increasing the coverage of the nursing homes and assisted living facilities and family type homes to increase the visits and also recruiting of volunteers. There also is a big advocacy push right now that they're focusing on the personal needs allowance for nursing home residents, which has not been increased for many years. Back in the 80s, I think, was when the last time, and it still hovers around $50. So they're trying to work on getting those folks a little bit more funding to live on. Targeting the Office for the Aging, State Office for the Aging requires us to ensure that our funding federally and state and the county as well is going to serving underserved populations. And that is a variety of different areas of folks that we try to serve, but we're trying to maintain equitable service for people that in the community, older adults from all areas of Tompkins County, and we'll continue our outreach efforts in those areas, especially those who are isolated, living in rural portions of the county, and to continue to engage lesbian, gay, bisexual, and transgender older adults. Supporting social engagement. This is something that was very highlighted throughout COVID, and it's still something that we put a lot of our efforts into ensuring that people stay engaged and aren't facing loneliness and isolation on a regular basis. Some of the innovations that Andrea mentioned, Project Care, Friendly Visiting Program. Again, I'm not going to read all this, but all this information is in our plan abstract. Our plan abstract can be found on our website under the same link that the Zoom link was on for this meeting, and also in paper form. If you call our office, we can send you one, or you can stop by and pick one up. So Project Care program, though, it's a friendly visiting program that we are trying to increase our volunteer capacity. We do have people that need matches currently, and so recruitment is always important. And we're also utilizing telephone reassurance as a means to reach older adults, and as another volunteer opportunity for people. Companion pets, those are our robotic pets, the lifelike robotic pets. There's many people that really truly love them. We have them in the office. We have cats, we have dogs, we have birds, and these interactive pets offer support, comfort, and companion pets to older adults. A virtual senior center. This is something that also came out of COVID. We know we have physical senior centers in this community. We have Lifelong that we contract, but each municipality has a senior group that's usually very active and engaged. This is just another opportunity for people to have access to a virtual senior center that offers courses and chat groups and all sorts of different things to just keep people engaged in multiple different ways. And our Joy for All board games. The companion pets are Joy for All companion pets, and they branded out a little bit farther with board games. These are intergenerational board games that folks can come to our office and borrow or have in certain circumstances. And also Lifelong has a supply as well. To go on, client satisfaction. This is something that we measure regularly, that we're required to measure, but we also use our result. The county uses the results-based accountability model. It's now changed names a little bit. However, it's the same surveys that we're doing annually to monitor our satisfaction with our programs and to have real data to show the impact of what we do with our funding. And we'll continue to do those and dive a little deeper with some of our satisfaction surveys, including with our, we'll have a survey coming out soon for our health insurance program, a caregiver satisfaction survey as well. So the folks that access those services will be reaching out to them and making sure that their experience was positive. Transportation. This is another initiative in 2024. We partnered with the State Office for the Aging, partnered with GoGo Grandparents, and they provided a supplemental transportation funding opportunity for all counties. Not all counties took advantage of this because they don't have the Uber and Lyft system in their communities. However, GoGo Grandparents uses Uber and Lyft, and it's specially trained drivers and that receive the special training and technology to provide rides for older adults. So they have to have a special star rating. We received a subsidy from the state. They even added additional funding to that. And we went through that very quickly. It's become very popular. And we will be adding some of our own unmet needs funding to expand this service for the rest of the year. Okay, personal home care aides. In 2022, we began directly providing a personal home care aid just because of the lack of home care aides in the community. The workforce shortage here, it was local, but it was across the state and nation as well, for that matter. We had one part-time person in that position and have been regularly able to serve about 15 to 20 people. We just recently hired another half-time personal care aide. So we're going to be able to expand that even further. She just started Monday, so I hope to increase those numbers a little bit more. Caregiver Resource Center and Alzheimer's Support Unit. That is something that we've done for a very long time. Some of the national regulations have changed it a little bit, and we've shifted to meet those requirements. But basically, our program is to help provide resources and assist and empower caregivers. Trualta is one of the initiatives that kind of falls under the umbrella of our Caregiver Resource Center. It's a web-based caregiver education and support platform at no cost to any New York State resident. Archangels is also a national movement and a platform that is reframing how caregivers are seen, honored, and supported, and even how they identify. A lot of people don't identify as caregivers, but often, once they go through this the assessment, they realize that they certainly are a caregiver and that they possibly need support, and we're here to help them through that. And we have it kind of directs them to our resources and our information. Caregiver assessment platform. Again, we began using the Archangels platform under this National Family Caregiver Support Program, which is a federal program. That federal program is partnered with NYSOFA, and we receive additional caregiver funding under the state to kind of make a patchwork quilt of all our services that caregivers can access in our office. Okay, policy trends. There's a lot this year. There's a lot of different policy trends we're tracking, but one of the ones that is consistent and that's been worked on for a while is the finalization of the master plan on aging. So that is still something that is, outlining there's 100 different proposals. How that will come out and how that will be funded is, for us to, it's all going to come to us eventually. We don't know exactly how that looks. We know how it looks on paper, but what does that mean for us directly? We will be monitoring that and aligning our work and with the pillars of the master plan on aging, which is prevention, promoting equity, community integration, supporting families and caregivers, and continuum of care and workforce, addressing social isolation and loneliness, supporting and strengthening caregiver resources. We're also participating in the Community Health Network Transformation Grant, which is now called something completely different, but it's a social care hub to address the social determinants of health or health-related social needs to include, to improve health outcomes. And we've partnered with Cuga Health on some of this work. Also reviewing the long-term services and supports delivery system and how to navigate it. That's something that's very difficult and ever changing. We try to make it our business to understand it the best we can and help people navigate through that difficult system. The next slide is really, I'm not going to read them all again. It is something that, whoops, maybe if I stop for a sec. It is our unmet needs list. We always have an unmet needs list. There's always gaps in the community. Even if we address and take some of these unmet needs off our list, there's always going to be another unmet need that is coming to our attention. So these are in the plan abstract. Some of these have been on here for many, many years. Some we've been able to take off, which is always exciting, but this is our current list this year. Now into more finances. So this is just a pie chart of our funding. And I'm not going to go over every detail, but you can kind of see how much of the funding is county and state and federal. It's broken down in the little spreadsheet on the side. And the other piece of it, just that's not on here, but I can kind of just break down our funding, what it's used for. Like about 12% of our funding goes to our New York Connects program that I mentioned. That is information assistance, referral, counseling program. about 32% of our funding goes to nutrition services. That's our home delivered meals, our congregate meals, case management, nutrition education, and counseling. About 15% goes to our in-home care services. That's the ISEP program that Andrea mentioned, expanded in-home services for the elderly, our case management, our home care aides, and our contracts with folks in the community. And the rest of our funding, which is about 41%, is all of our other programs, all of our administration, all of our staffing. Okay, and next is just another slide of our funding broken down in a different way. Whoops, did I stop sharing by mistake? Nope.
Okay.
Sorry about that. This slide is just a comparison from the year before. You can see that there's some areas that decrease and some areas that have increased significantly. And it does all balance out. One thing that stands out probably to some people is the unmet needs program. We just found out recently that we're getting additional funding for 2025 and that we will be using that quickly. We only have till it runs on the state fiscal year, which is the end of March. So we will be shifting gears to use that up the best we can. And lastly, I don't know if everybody's heard, but we are moving. We don't have the exact information about when we'll be moving, but this building is a picture of Dutch Mill Road and it's in Lansing, Ithaca. We're not quite sure on that, because we've seen the address be Ithaca and Lansing, so we'll narrow that down. But we recognize that this is going to be a time to adjust for both of our clients and our staff. We understand that, we're going to be working through some bugs. We just hope, want to ensure people that we're going to maintain the highest level of service delivery that we can in the workload that the staff already is doing. Our commitment is always to the older adults and caregivers that we serve in the county. And no matter where we are, we're going to figure out a way to meet those needs. Yeah, and I think that is the last of my slides. But I again wanted to reiterate that the information it is all on our website, which is the tcgov.co/COFA. And it's all under the public hearing. The plan abstract is under the public hearing. And there's also a survey link for feedback that you can share with everybody you want. That we will be open to getting feedback for how long, Karen?
It's open through, I believe, the third week of October.
Okay, so even long after this, and again, this recording will be available for people to review again. And we're certainly always available for questions. I'm going to stop sharing so I can actually see people. Yeah, we're always available for questions, but that feedback form has 3 different questions on it, and it has an open-ended question also at the end that you can provide any additional feedback or questions that you have that we can try to answer for you or incorporate into the work that we do. So I'm going to first open it up to Karen to read some of the comments that we already had prior to this, and then open it up to the chat that was chatted in if there was any questions, and then we'll allow more time for people to ask questions live. And I'll try to answer them the best I can.
Okay, so we received 2 emails prior to the hearing. And I'll just read, there are more comments than questions, so I'll just go ahead and read them briefly. I have had to abort several procedures due to lack of transportation. Syracuse provides free transportation to their patients for free when a procedure is necessary. For many of these procedures, you are not allowed to drive there or home, which leaves no choice but to cancel if no relative is available to help. My family lives in California and New Hampshire, so I can't get necessary procedures done. You would think as expensive as healthcare is that transportation would be available as in Syracuse. And then the second comment we received was advocating for pedestrians would be an admirable goal. Elderly need a safe pathway without wheeled transport zigzagging by and near. This is especially true on the downtown Ithaca pedestrian primary commons. Advocating for safety in this pedestrian area would be great for walkers.
Okay.
There's that. And then as
I'll
far as our
just-
chat, oh, sorry, go ahead.
I was just going to say, I mean, we take these comments into consideration, and we try to advocate the best we can with some of the comments we get. I can say the transportation out of the community was one of the things that we had on our unmet needs list for a long time. I can't remember how long, years, decade maybe or more, about transportation out of the community, and GoGo has been able to meet that, the GoGo transportation subsidy that I was talking about. So it's not 100% foolproof. It is not widely, it's limited with funding, but it is an option at least that we didn't have before. So, we will work on all these comments that are made and try to make some things happen.
Okay, and there was a really simple question in the chat that I answered. I was asked how to contact the virtual senior center. And that was an easy one. You can just reach out to Lifelong, 607-273-1511.
Thank you. Is there any other chats, Karen? I can't see them.
Nope, that's it.
Okay. Yeah, so does anybody have any questions that they would like to provide or ask here, or provide any kind of feedback that we can incorporate? Or if you don't feel comfortable doing that, like I said, the survey, or call us anytime to let us know these things.
And did you have your hand up?
Yeah, the picture of the new building looks like it's much more accessible. And it looks as though there might be some decent parking. And, you know, I've avoided trying to go to the Office of the Aging when I'm maybe wanted to, because,
Mhm.
you know, having either to park across the street and navigate a system that I don't quite understand, and take my rollator across this busy street, or
Mhm.
get out on in the middle of traffic. It,
Yeah, yes, you're 100% right. If you do drive, I think people will prefer that. It is very accessible. It's flat. The entrance is right near where you park. There's plenty of parking. So if you're able to still drive, it's I think you'll prefer it.
I say hooray.
Thank you. Looks
And
like Harry,
Harry?
do you have a question?
Yes. A couple of weeks ago, I inquired at your office about the $25 grant for produce, and I got the mixed message that my wife and I make too much money to qualify for that,
Mm.
which is a mixed blessing, obviously. But my question about that is, do you have the same income standards for every program you offer?
No, no, that most of our programs have varying eligibility levels, and it's usually not something that we set directly. It's under the requirements of the funding. So, you know, there's different eligibility rates for our ISEP program, you know, SNAP, HEAP. I think, you know, the Senior Farmers Market Coupon Program is set by Ag and Markets is who sets that. So it does vary. I mean, generally, we know we have poverty guidelines is what they call it, and it shows what certain people could be eligible for, but it does fluctuate, and that's when I ask my staff to talk to somebody because there's so many little nuances about every single program. It's best if you have questions just to call us and talk to one of our aging service specialists who really knows the ins and outs of that.
Thank you.
Mhm.
Good answer.
Hi, Beth.
Hey, Lisa, I just want to compliment you and your staff and to emphasize that one of the things that you do so well is that you collaborate with other people and make those resources that are scarce stretch even further. So that is a compliment to all of you, and thank you.
Well, thank you. I appreciate that very much. It's always great working with you. I don't know. You seeing anything else, Karen, that I'm missing?
Nothing in the chat.
Okay. Well, I will say again.
Carol.
Oh, Carol.
would
Hi,
like to say
Carol.
something.
Just muted, it looks like.
Got my
Oh, there
hand
you
up
go.
a little late there. I just would like to comment that I think the move to the Dutch Mill Road is a huge problem for a lot of seniors, and I think your current location is much more advisable. It's near other senior programs that people are often taking advantage of, like DSS and Longview. It's near senior housing like McGraw House and Titus Towers and the place that will be built across the street. And the new place, although it may have great parking, has no public transportation. So it greatly limits the availability of services to seniors who need to be able to get there by public transportation. If people are interested in letting the legislature know what they think about this move, they can come to the meeting. I think I don't have my calendar right in front of me. Is it October 13th?
7th.
7th. So, I'm sorry, you're right. So October 7th at 5:30, and you can speak from the floor and make a statement up to 3 minutes and let the legislators know your thoughts about what this move is going to mean to you or to other seniors that you're aware of.
Thank you, Carol. Yes, no doubt the public transportation is difficult. You know, we will certainly work with everybody individually and make sure that they are able to get to us if this happens, and or we get to them. Again, I think the best thing to do is if there's no transportation for people, is to call our office and we will help you figure out a way to get your needs met. But I think Deb has another question.
Not a question. Can you hear me?
Okay.
Okay.
Yep.
I just can't resist taking this opportunity to all those out there that we still need other people to volunteer to serve on the advisory board. And that is a great help to the community because people come from different groups, different locations around the county. Having been on this board for 3 years, it's a wonderful group of people, dynamic, and full of information. So if it's not you, perhaps you have a friend or a neighbor or someone, but we do have many open seats that we would like to see filled. So
Thank you for
I'm
that, Deb.
speaking there as the vice chair of the advisory board. So
I
thank you.
appreciate it too. Thank you. And Anne,
Can you explain how you get tickets to Gadabout?
you can just call our office and we will hook you up.
Oh, okay.
Yeah, we usually send them in the mail if you give us the information, and we give them once a year. It's limited. We can't give them all the time, but we give out, I think we're giving out 10 at this point.
20.
Is it 10? 20 Gadabout tickets a year, and that's for one-way trips. So it's, if you had one trip, it would, one-way trip is one ticket. Am I explaining this correctly? Yes, I am. Yes. So 20 tickets is one way all the way around your ride. So, yeah. So just call the office and we would get them to you.
So if you're getting picked up after the event, that's
Yes,
two tickets.
that would be 2 tickets. Yep. You go to the event, you get picked up, go back home. That's 2 tickets. Yeah. Well, seeing nothing else, I think I will end this, but please let people know that this will be up and available to view, that the survey is still out there for people to provide feedback. We can send it to people's homes. You can call our office and fill it out over the phone. There's multiple ways to provide feedback to us, and we certainly will take all of it into consideration.
Thanks for doing such an amazing job.
Thank you, Carol. Well, thank you all, and I hope you have a nice rest of your day. The sun is shining, so enjoy.
Thanks for the presentation.
Thank you. Meeting.